ask Dr. Stack to come up for a minute. We are seeing some concerning outbreaks that are being caused by areas where people are traveling to right now. Myrtle Beach is one area that we are seeing causing outbreaks in other states and in Kentucky. We need people to be really careful. You know, New York, New Jersey, and Connecticut just announced that if you travel to a state that has a certain threshold of positives, that's everywhere it's growing, that you'd have to quarantine when you come back. We're not there, but we're asking people, if you know that there's a place that we can tell you that there are a lot of outbreaks, don't go. All right, Dr. Stack.
Thank you, Governor Beshear. So I'd like to just remind folks that as we look forward to the summer and as we look to June 29th and we move to phase 3 in Kentucky for reopening more activities, it's absolutely imperative that you follow the guidelines we've administered or that we've recommended, because if we don't, we have circumstances like what I'm about to describe, and this represents a serious threat to our health and wellness. So we've identified a number of clusters tied directly to travel to Myrtle Beach over the last few weeks, actually dating back into May. So Myrtle Beach, just to give a summary, a very popular summer destination for many folks, opened their hotels May 15th, opened attractions May 22nd, a week later. About a week after that, they started seeing case numbers increase in Horry County, which is where Myrtle Beach is located. On June 11th, the mayor of Myrtle Beach declared a state of emergency. So it just took less than 4 weeks before they went from reopening to declaring a state of emergency. On June 17th, West Virginia issued a health alert because they had a cluster of positive COVID patients from Myrtle Beach. The next day, they identified a second cluster of people who had returned from Myrtle Beach. On June 11th, we had 12 Kentuckians travel to Myrtle Beach. They returned 3 days later on June 14th. At least 9 of those 12 people who traveled to Myrtle Beach, that's 75% for the math, have come back positive for COVID-19, and they had symptoms starting as soon as 4 days after their return from that trip for the earliest. We now believe we have a second cluster that's tied to Myrtle Beach, and we have a third individual who went there who has also come back positive for the test, or for COVID-19. So we have now identified, both in West Virginia and here in Kentucky, numerous people who have returned from Myrtle Beach with COVID-19. I have to continue to urge and beg folks, be careful. It's not time to be cavalier, because I just described a scenario where a place that was just starting a reopening process went from being fine to a state of emergency in 3 weeks. So the fastest way we can create a problem for ourselves is to ignore guidance like wearing masks, which is a relatively easy thing to do, maintaining social distancing, and having proper hand hygiene. Thanks, Governor.